Thank you very much for taking the time out of your busy schedules and joining today's patient activation and self-care conversation, where we are having a particular focus on patient activation measures. Here at the Innovation Agency, we classify all our innovations into various categories and solution themes, which reflect the health and care landscape and redesign challenges that we are all facing. So to define patient activation and self-care measures, we are meaning those products and services that support people with an existing diagnosis to manage their condition, provide support and education to increase patient activation that will reduce the likelihood of exacerbation of the condition, and those products and services that provide information and advice which helps maximize their well-being. So we've got two exciting speakers with us on the call today. Firstly, we'll be hearing from Katie Goulding. Katie is from Blackpool Teaching Hospitals, where she works as an organisational development facilitator, and Katie will be speaking on the patient activation manager tool. We'll then be hearing from Yvonne Lane, who is our patient representative, who will be talking about her personal experiences of using the low carb programme and putting her type 2 diabetes into remission. We had also hoped to be hearing from Dr. Campbell Murdoch, who's the Chief Medical Officer at diabetes.co.uk, who was hoping to speak to us specifically on the low carb programme. And Dr. Campbell Murdoch had prepared a pre-recorded video message for us, but unfortunately, due to unforeseen technical issues, we're not able to show that video with you today. So what we will do is after the webinar, we will be sending out an email which will contain a link to the video so that you can access it online at your own leisure. You will see that we have an active chat box available, so please do pop any questions that you have into the chat box, and we'll aim to answer any questions after each speaker has finished their talk. So, and just to mention for housekeeping that everyone on the call today has been muted upon entry into the webinar. So without further ado, I'll hand over to Katie.
Hello, so...
Hold on a sec, Katie, let's just... you should be in charge now, you should be able to share your slides.
There we go.
Great, thanks very much. Brilliant.
Excellent. Hello. So, yes, so my name is Katie Goulding. I work for Blackpool Teaching Hospitals in organisational development, but I've been working specifically on the personalised care agenda across the South Coast. I've been asked just to share a little bit about how we've worked with the patient activation measure over the last few years across the South Coast. But before I do, I want to... Hold on a second, it's not moving on the slide. There we go. But before I do, I just want to tell you, I guess, a little bit of a story that I tend to start with to introduce, I guess, where we come from on the Far Coast when it comes to patient activation and supporting self-management. It's a story that outlines probably one of my favourite childhood memories. When I was probably around the age of 7, my parents came into the living room and told my sister and I to get ready to go out because we had to run some errands, which of course as a 7-year-old is exactly what you want to spend your Saturday afternoon doing with your parents. And we got in the car and got to the end of the street, and my dad turned around and he looked at me and he said, "Katie, do you want to go left or right?" And he'd never asked me that question before. He'd never asked me which direction to go because he was always in the driving seat and taking control of where we were going. So quite excitedly, I chose to go left. And at the next junction, he turned to my sister and said left or right, and she made her decision. And we carried on in that vein until we eventually reached a junction, and I could see in front of me the picture that you should have on your screen right now. And my sister was about to turn right, and I was like, no, we need to turn left because that's exactly where we need to go. And so after a little bit of debate and discussion, we pulled the car up, we parked the car, I got out, went for a walk on the prom, got some donuts, and then went for a ride on the big one. And the reality is that day is a real treasured childhood memory for me, not because it's a memory of a fun day out, although it was a fun day out, but it was a memory of having a different kind of conversation with my parents. They shifted their relationship in that instance, and they allowed me and my sister to be involved and take control of what was going to happen and where we were going. And when we talk about personalised care, when we talk about supportive self-management and patient activation, that's what we're trying to do. We're trying to shift that relationship between health and care professionals and people. And you hear a lot the conversation being that we need to stop asking people what's the matter with them and shift it to asking about what matters to you. And you can see on the screen there all the different shifts that we can be making. So seeing patients as a patient with symptoms, rather shifting that to seeing a person as a whole person with skills, strengths and attributes, as well as needs to be met, and all those different shifts of what we've been trying to address and what we've been trying to really support the mindset shift across the Fylde Coast over the last few years to do that. One of the ways we've done that has been by using patient activation, because we believe that understanding someone's activation level really supports a new kind of relationship. So we define patient activation as the knowledge, skills and confidence that a person has to manage their own health and well-being. It's a tool that was developed by Professor Judith Hibbard through the University of Oregon, and she was doing some research into the key characteristics of people who got better health outcomes, and not surprisingly they came out as being knowledge, skills and confidence. Where people had higher levels of knowledge, higher levels of skill and higher levels of confidence, they tended to get better health outcomes and demonstrate better self-management behaviours as well, and be a little bit more proactive about working out how they can manage their condition in the best way possible given the circumstances that they're in. And so that's where the term patient activation came from. So whenever we use the term patient activation, I can tell you that I've got running in the back of my head, that means knowledge, skills and confidence. So what was developed off the back of that research was a 13-question questionnaire that asks patients to self-score themselves based on 13 different questions or statements on a scale of strongly agree all the way through to strongly disagree. So, for example, the first question or the first statement is, I'm the person who is responsible for taking, I am the person who is responsible for my health and well-being and my health care. And obviously patients can then score between strongly disagree all the way through to strongly agree. Other questions include, I understand what each of my prescribed medications does, and I think the last one is something along the lines of, I feel confident that even during times of stress I can maintain healthy lifestyle behaviours such as healthy eating and exercise. And so we ask patients to score themselves based on what is true and real for them, and that gives us a real insight as to what their perception and what their beliefs and what their approach to managing their health and well-being might be. Once that's been completed, the results get inputted into a scoring spreadsheet that populates two numbers for you. One is the score out of 100, which is what you call the patient activation score, and the second is 4 levels. That score out of 100 gets sorted into one of 4 different levels, which makes it helpful for us as practitioners to be able to understand where is this person at, how are they feeling about their health and well-being, and therefore what is the best way for us to begin to support that person around that health and well-being. How can we have a shift in our relationship with that person to meet them at the place that they are at, rather than expecting them to come and meet us at the place that we are at. So the 4 levels you can see on the screen in front of you, level 1, 2, 3 and 4. The level 1 will describe your patients who are starting to take a role. They very much would take quite a passive role in their health and well-being, and their perception and view might be that we as healthcare practitioners are primarily responsible for that person's health and well-being. Often they can present maybe quite disengaged or quite overwhelmed, which is really helpful insight for us to have, because if we know we're working with someone who's at a patient activation level of level 1, it helps us kind of start to think about and understand what is it that's causing that person to feel a little bit disengaged and overwhelmed, and how can we support them in that place. Your level 2 patients are your patients who are beginning to build knowledge and confidence. So they're starting to join the dots. So they're starting to recognise that maybe there is something more that they could be doing around their health and well-being. Maybe actually when they walk out of the doctor's surgery, there's some things that they can do to help improve their health and well-being and support that supportive self-management kind of thinking. They might be able to connect the dots between what you eat and the impact that has on your weight, or what you eat and the impact that has on your diabetes management, or areas like that, but they're not quite ready to do anything about it because they still would be hesitant to play that role for themselves and feel that they need the support of healthcare practitioners around them. Your level 3 patients are your patients who are starting to take action. So that's where they have shifted in their thinking from I am a passive recipient of healthcare to actually I need to be an active participant. I need to partner with my health and care practitioner that is supporting me. Often patients at this level are wanting to set goals, wanting to make changes, wanting to take action around their health and well-being, but they might need just a little bit of help in feeling more confident, or a little bit of help in developing the skills they need, or sometimes a little bit of knowledge around what is going to be an appropriate goal for someone at this level to reach. You know, sometimes you might hear someone at this level wanting to make changes and set goals that perhaps are a little bit too ambitious, or are actually not necessarily going to be the right kind of goal to help them achieve what they want to achieve and get to where they want to get to. Your level 4 patients are your patients who are maintaining those positive behaviours. So they would play a very active role in their health. They would tend to be very good at asking the right kind of questions. They would tend to be very proactive at getting appointments with the right people when they need to have those appointments. And they would probably come into a consultation or appointment having done some thinking, having done some planning, and be willing to play that active role. And working with these patients is around continuing to help them reach those stretch goals, but also helping them to think about what would happen if something changed in your health. How would you maintain the momentum that you've got and the positive behaviours that you've got? And so the evidence shows that if we can support people in increasing from level 1 through to level 4, or even from a low level 1 to a high level 1, that actually has really felt impact and felt benefit on how that person experiences and engages with their health and well-being. One of the things that we've used on the Fylde Coast paired up with patient activation is a health coaching approach, because what we know is that one of the techniques that really consistently supports people in feeling more knowledgeable, skilled and confident and increasing their activation is a health coaching conversation. So we talk about health coaching conversation in terms of asking our clinical practitioners to bring their clinical skills and data to the conversation, and add to that a coaching mindset, which is believing in the potential and the resourcefulness of the people that we're working with, and actually believing that the people that we're working with can reach the goals and make the changes, and they have the resource within them to find their own solutions. And then adding to that knowledge and information around behaviour techniques. So we ask our clinicians and our practitioners to take those 3 things together and put them through the filter of what we know about person-centred care, what we know about activation and knowledge, skills and confidence, and what we know about the importance of helping people to develop their own action plan and finding their own solutions. And what that results in is what we would call a better conversation that we know helps people grow in knowledge, skills and confidence. So we've done a lot of work across the Fylde Coast trying to support our teams to do that. We actually began back in 2015 as a vanguard around a frailty model in the community, and that's where we started to introduce patient activation. We started it as a pilot with around 20 or 30 patients and some of our health and wellbeing support workers who take a health coaching approach to helping patients reach and achieve and set goals that are meaningful and that matter to them. We followed that up with some health coaching training for our initial wellbeing support worker cohort, which enabled us to expand that right across that use of the patient activation and the health coaching right across that one particular service and team. And off the back of the feedback that we got, we were able to then put forward a proposal to the divisional board for the community teams to develop a train-the-trainer program around health coaching, which we were then that enabled us to be able to spread that learning and that training right across the whole of the community division. So we currently work with around 25 to 30 different teams at the minute, either on the health coaching training process or helping them embed the use of patient activation in their everyday business as usual practice. We've since then gone on to do some development and some OD pieces of work with each of the teams to be able to listen and embed and refine and support each of those teams, and not just having learnt the skills around what patient activation is and what health coaching is, but to be able to embed it in everyday practice and bring it into a real culture, like a real cultural norm in our organisation. And what we're also doing is developing another train-the-trainer program across Lancashire and South Cumbria to take that a little bit wider and more broadly, and to be able to support teams right across the ICS around health coaching and patient activation. Our process has been quite quite specific, and we've followed the same process with every team. There's quite a lot of flexibility in it, but we've always started off with staff engagement, so service engagement, meeting with team leaders and sharing with them what patient activation is, asking them to identify a champion, asking them to think through how this might work in their pathway. We've then introduced a PAMS awareness training, so training teams around the concept of patient activation, and then supported that with health coaching skills as well, and as I've just said, supporting with the embedding. What we've found is that 67% of patients have improved their score. In terms of that score out of 150% have moved between levels, so maybe from level 1 to level 2. The average PAM score increase has been 7.6, and we've trained at actually now almost 500 people in health coaching training, and we've got 14 coach training, trainer individuals within the system as well who help support that training. There's a slide on the screen now. For time, I won't go through all of it, but hopefully we'll be able to share the slides afterwards. But one of our patients, his name is Stephen, actually went through a service that was using both patient activation and health coaching. He started at a PAM level 2, and when we discharged him, he was a PAM level 4. He had lost 4 stone. He'd got his health back under control, and he actually said that he found that being involved in decisions around his care and being met at the place that he was at actually meant that he walked into the program with his eyes closed but walked out with his eyes wide open, and it actually motivated him to make changes and find the solutions that worked for him rather than the solutions that other people told him might work for him. We've learnt along the way that we need to make sure that we're developing the right capabilities in our team, that we're telling stories that increase motivation, but also really practically we're looking at how we create the opportunities in everyday practice for people to begin using these conversations. There's lots of things that we've learnt along the way, but they will probably be the three big ones that we've learnt. So that's a little bit about what we've been doing, what we've been learning, and hopefully it's been interesting and helpful for you to hear.
Thank you very much, Katie, for that excellent presentation, which was really insightful and informative into patient activation. It's great to hear about how you're going about building knowledge, skills and confidence in patients, changing behaviours, and an emphasis on how you're refocusing the relationship between clinical teams and patients. We've been keeping our eyes open on the chat box. I can't see any questions posed from the audience currently. I've just got a question myself. Just in terms of, it's quite a different way of working, a different way of people thinking and managing health. How did patients and the clinical teams respond to the different way of managing the patient-clinician relationship?
I think that's a huge one. So we talk a lot about the mindset shift, and that's why we have been really clear that we don't just want to do training, we want to really support teams to embed the learning. So we use a lot around the COM-B model of behaviour change. So we think about what capabilities, motivation people need, it's probably been one of the most significant things that we've had to do is around thinking about that mindset shift. Even the training program itself is designed in a coaching way, so we coach people all the way through to try and help people rethink that, and we recognise that people are not going to do it in one go. It's an ongoing process of just having a go at these new kinds of conversations and having a little bit of courage, I guess, to try things in a new way. So we encourage people to start small, maybe just pick 1 or 2 patients that they want to work with, and then build from there. And some people get it quickly, other people it takes quite a while.
Great, excellent, Katie. Thanks very much. There's a question that's been posted in the chat box from Moni Deepa. So I'll just read it out to you. So how do you work in technology, such as smartphones and apps?
Sorry, say that again.
So how do you use technology such as smartphones and apps in helping patients self-manage their health? So do you have any apps or anything like that which you've used for this patient activation approach?
We've not done any specific work around patient activation and digital. We have been a test bed site, so we have used some of the systems around apps and things like that that have included patient activation within the work with that particular cohort of patients, but it's not been something that we've particularly focused on yet, although it is something that we are continually having conversations with our digital team and with NHS England about as well.
Yeah, sure. Okay. We've got another question as well. Thanks very much for that. We're just working on getting the other question through.
Great.
Can you hear me, Ed?
Yeah, we can hear you.
Yeah, go for it.
Brilliant. Hi, it's Jen and Steve, Innovation Agency. First of all, can I just say I really enjoyed your little presentation, Andy.
Thank you.
And I'm really encouraged with sort of the language you're using as much as anything. I'm an ex-nurse myself 30 years ago. So just before I ask my question, I just want to use a couple of words I've been using a lot as well, trying to, encourage people to think and act differently. So when we talk about patient activation, I also think it's about, in the NHS, we look at a patient's condition, and sometimes we don't pay attention to their circumstance. And I think social care can be guilty of that when the patient goes back home. If you're having a holistic view, to me the language is the person's condition and their circumstance. Both can affect the other one.
Yeah.
I think also, when we're asking patients to take more responsibility for themselves, I've always used the words, choices have consequences. The good choices have good consequences, bad choices have bad consequences. So
Yeah.
we're encouraging people to be really honest with themselves.
Yeah.
Also, the passive pajama patient of yesterday and today is going to become more discerning. I'm sure of that. So my question is actually about what clinical reservations and resistance did you encounter?
Time. We don't have time for having these conversations is a big one that we've come across. Again, that's where we just say, well, just start small. You don't have to do everything all at once. And then also we do have conversations a lot around that idea of choice and people having choice. So we have those conversations. So we have those conversations around choice, and actually we as clinicians are the experts, and so we know the right way and the right answer, and what if a patient makes a decision that isn't the safest decision. And so again, that's the mindset shift around recognising that if a person has capacity to make a decision, as long as it's an informed decision, and we're helping, we're giving that information to them in a clear, easy way for them to understand. And so it's just all done through conversation, really.
So when I've talked to clinicians about trying to make improvements in patient engagement, I always think about the fire service and what they did in the 70s. They were spending 80% of their time putting fires out, so that's the equivalent of the NHS focusing on disease and distress.
Yeah.
If you are going to prevent fires like the fire service did, they only spend 8% of their time putting fires out now. It was that thing of how do we get patients to realise they can prevent having three long-term conditions. Yeah, and I think there's something that comes through for me in terms of professional identity and our view of what we are there to do. And I think very often we believe we're here to fix people, and it's actually about challenging that a little bit in a really supportive way that helps people think through what if we were here to empower people and enable people to make the right decisions to set them up well for the future. Okay, thank you.
Thanks very much, Steve, for all of those questions, and thank you very much to Katie for your presentation and for answering all those questions so well. There was a question as well about certain what apps are available to help patients manage their own condition, and just to mention that at the Innovation Agency we've got a plethora of apps and solutions that we are aware of from all our local businesses which have developed these apps. So we would be willing to share that information with any other team. So please do feel free to get in touch with us, and we can help look at which apps may be relevant to your particular area of healthcare. So I think we'll now move on to hearing. We'll now move on to hearing from Yvonne Lane, who's our patient representative, who's kindly joined us today. So Yvonne's going to be talking to us about her experiences of using the low carb program. So Yvonne, we're just in the process of handing over to yourself. You should be able to hear us now, Yvonne, and you should be unmuted, so feel free to go ahead.
Thank you for giving me the opportunity to speak. This is something that I've become entirely passionate and almost evangelical about. So I wanted to start by saying that perhaps the strongest message that would be important to get across to patients is that my diabetes diagnosis has really been truly life-changing, and it actually in an entirely positive way. I think the message often is that it's a progressive condition that requires lifelong medication with potentially life-threatening complications. But actually, in terms of my own engagement with it, with use of the low-carb program and this way of eating, specifically for me, a ketogenic way of eating, which is very, very low-carb, I think it offers those with type 2 an opportunity to really take control of their own health in much the way that Katie was talking about in terms of their objectives. And in terms of health, it's been not just a physical transformation, but also an emotional transformation. So just some really top headline statistics. I was diagnosed with type 2 diabetes towards the end of 2016 with an HbA1c of 108, which, as my GP said, was extremely diabetic. By following the low-carb program, changing my way of eating, adapting my lifestyle, my HbA1c is now 30. It actually dropped to non-diabetic levels in less than a year, and I've then maintained that ever since and actually slightly improved it. It wasn't just my blood sugars. So my blood pressure has gone from 158 over 102 down to 110 and 67. And in the process, I've lost almost 43% of my body weight. So I started at 101 kilos and went down to just under 58 kilos. For me, that was achieved. Really, I got very limited information from my GP. Through Googling, I found the diabetes.co.uk website, their forum, and also the low-carb program. Having followed that program, moderation is something that doesn't come easy to me. So I was actually one of those who just went completely cold turkey. So almost immediately, I stopped eating any starchy carbs. So no rice, no bread, no potatoes, no pasta, which is actually quite difficult when you first do that, especially if you were someone like me that was eating vast quantities of those. You go through a period where it's almost like a withdrawal. And I think for me, I had support from people on the forum. I think that's where that kind of support that you might get from a healthcare practitioner that we could let you know that that was temporary and it was worth sticking with it would be something that's really important. So in terms of what I was and am eating, it's really, the only carbohydrates are really in the form of green or above ground vegetables. So things like spinach and cabbage, broccoli, cauliflower, all those types of things, and then just real food, unprocessed food, so meat, fish, eggs, dairy. Over time, I've adapted. I've begun to understand through the low-carb program, through interaction on the forum, different ways of managing this way of eating. For me, because of the blood glucose issues and wanting to really deal with insulin resistance, I've started, well, quite early on, I started using intermittent fasting just by skipping breakfast. For a while, I did periods of actually only eating dinner. Now that I've lost weight, that's actually quite hard to do because I don't have fat reserves to run on. But I still use the narrower eating window. Alongside of that, I also started to increase my exercise very gradually at first. I do live in London and I use public transport, so there was a base level of activity. And I just decided the best way was to build activity into my everyday life. So it didn't depend on having to find an hour or two, 3 or 4 times a week to go to the gym or whatever. So literally I started just doing my normal walking, but going a bit faster. And then I did things like extending the walks, adding in opportunities to walk. So rather than taking the bus or a tube, walking further. So for me, it's not just the eating, it's the whole package, and transforming the way that you're actually living your life. I think in terms of the implications for my health and well-being, aside from those statistics I quoted, I just now have so much more energy, really so much more energy, much more confident, much more engaged socially, less hungry. There's no need to plan my days around food. And I think starting to change your relationship with food and actually feel that you can change your life through your own actions, and actually through something simple that doesn't involve medication, it doesn't involve depending on other people, it just involves you understanding the implications of what you eat and what you do, and being able to, I think as you were saying, Katie, about the choice, understanding what the choices you make do and the impact they have. So alongside understanding what I'm eating, the use of a meter, a blood glucose meter, helps you to gain that understanding, and that helps provide the motivation to continue. So I think having seen the benefits for myself, having had, now I have actually quite engaged conversations with my healthcare practitioners when they saw my results and they knew I wasn't on medication. It sparked a lot of conversations with my GP, with the nurses at the practice. So I'm trying to find ways to support them, to support others. And I think the real key is actually finding something you enjoy and you can sustain. So for me, I actually love this way of eating. When you first talk about it to people, they think it's difficult, it's hard to give things up. And yes, that's true at the start. But when you see the benefits, when you do it consistently, when you actually find things that you enjoy, that you identify things you can grab when you're out in the middle of nowhere and you know you can just go into a certain shop and they'll have something, I think it is transforming, and that's why I've become quite evangelical about it, and I'm keen to support in any way I can. I think that's all I've got to say for now, but I'm really happy to answer questions or provide information.
Thank you very much for that talk, Yvonne. That was really, really helpful. We've not got any questions just as yet that have appeared into the chat box. I've just got one for myself. How practically did the low carb program actually sort of help change your lifestyle choices and impact your decisions on food you ate, amount of exercise, things like that? How did it actually steer you in your lifestyle changes?
So I think it was very helpful because there's a series of different videos that you can use. So I think it gave you very practical advice. So I think when you're starting out, I think everybody would understand that eating sugar is not a very good idea if you have diabetes. But I think it helps to provide information that actually carbohydrates also act like sugar. So it's about helping you to understand all the different things that might impact on your blood sugar and therefore your diabetes, but also giving you practical tips about how you might adapt what you're currently doing so that it improves. I think myself personally, I made a lot of changes all at once because that's just the way I operate. But I think because the low carb program comes in chunks, it's actually very helpful for a wide spectrum of people, because if you're the sort of person that's a bit more hesitant about making a big change, or you prefer to do things more slowly, you can get that. You know, there's one about, looking at things you drink. There's one about different types of vegetables. So I think that's very practical and I think the fact that it's part of also the diabetes.co.uk website and the forum, it's like a package. For me, the personal support from forum members, the information on the website, it all comes together, and I think Katie was saying it's about treating the whole person and having that approach. I think it's also about having whole suites of information, because different people will respond and react to different things in different ways. And for me, it was that whole package that made it so practical and easy to use.
So did you get some like peer support as well? Is that kind of linked in with the program as well, so you can all spur each other on and give each other ideas and motivate each other?
So yeah, I don't think that's a formal part of the program, but because it's on the diabetes.co.uk website, there's a very, very active forum there of people who provide peer support effectively, and that has been hugely helpful. It's online, but actually it's so friendly. It's one of the most friendly online environments I've participated in. There's always someone who will answer questions, and you don't feel silly asking questions. There's always supportive people there.
That's really good to hear. And just for interest as well, how long were you actually on the program for?
To be honest, I don't think I've really left it. It's not something I keep going back and looking at, because I think now I've understood it. But it lasts 10 or 12 weeks. So once I started, I committed to it. And I think the important thing is you need to be ready to make a change. And the diagnosis was the thing that made me ready to make a change. But I also think, because it's videos, if someone does slip or they forget something, you can go back to it. So for me, it wasn't about a diet. It was really understanding it. I needed to just live a bit differently. And that's why I was emphasising about needing to find things that you enjoy. Because if you don't and you feel you're being forced to do it, it won't last.
Yeah, no, absolutely, Yvonne. We've got another comment that's come into the chat box. It's not actually a specific question, but just to share this to all the callers on the webinar this afternoon. There's Dr. David Unwin has made a massive impact apparently with this approach at GP practice level. That also includes reducing prescribing costs. And we've been given a link to a website which people may find valuable and useful. So what we will do is we will share that link and that resource to support callers on the webinar this afternoon. So what we'll do is we'll share that link as an email around to everyone following the conversation. So there's nothing else, Yvonne, that's popped up into the chat box, but thank you very much for joining us this afternoon and for that really insightful discussion and presentation which you did, and it's fantastic to hear about the benefit that the low carb program has had upon your life. And also I gather that about 400,000 people have actually joined the low carb program since it was launched back in November 2015, so it's clearly gained massive momentum and got a large influence across the UK. And that the low carb program's also, it's available as an app, and you can download it from the major app stores, and it's been approved into the NHS apps library. So I think that if there's no other questions, I think that concludes our webinar this afternoon. So a big thank you to everyone for joining the webinar again, and in particular a huge thanks to our speakers, Katie and Yvonne. So thank you very much, Katie. Thank you, Yvonne, for your time and efforts in joining the Innovation Agency this afternoon.